Appearing before the Parliamentary Public Accounts Committee was a team from the Ministry of Health headed by the Permanent Secretary Asman Kwago. The committee raised queries from the Auditor General's report for 2014, which indicates that over 70 billion shillings was misappropriated. The report shows that the money was spent on buying machines, some of which was outdated, and training for personnel who, it was later discovered, could not operate the equipment. In the report, it is indicated that the equipment was supplied by Sino Africa Medicine and Health Limited. The committee was basing its queries on the Auditor General's report where value for money on acquisition and utilization of medical equipment was underutilized.
One of the key things with this project was to reduce maternal mortality.
The query is here. You procured equipment, yes, and there was no theater, no doctor.
The committee found out that some of the equipment was lying idle in hospitals in different parts of the country, while some districts had machines that were obsolete.
The incubator machine, which was bought on the advice of this technical high-power incubator machine and put it in Iganga Hospital, to date, nobody uses it.
But the bidder has failed to conform to the specification, and I have no choice other than rejecting this equipment. But we realize all those risks and the losses which have been incurred. We are very sorry to the country that we couldn't provide.
The health officials also had to explain why they procured machines without a needs assessment and why medical workers had not been trained to use them.
See the findings or comments. User training not adequately done, user training required, user training required.
I totally agree with you. To train people to use an anesthetic machine requires some period of time. It is not a user training like you use a BP machine, because there is a lot of professionalism. It's not a machine only. There is also how to mix the medicines.
The committee chair, Ali Salasu, stressed that the accounting officer would be held responsible for the submission. More research, NTV at Parliament.